Whether during foreplay or the main event, fingers can be incredibly pleasurable for a woman when used well. In fact, with the right technique, some women can reach orgasm from fingers alone. Fingers bend, adjust pressure, change angles, and scale from 1 finger to 2 or 3, so they are precise tools, far easier to control than anything straight and rigid. I'm Dr. Fiona Grey, men's sexual health expert. Today I'll show you a step-by-step, respectful, medically grounded way to use your hands so the woman you're with feels safe, seen, and intensely pleasured. First, 2 essentials before any touch: consent and preparation. Ask clearly, "Do you want me to touch you here?" Keep communication open the whole time. Then prep the tools. Trim and file nails smooth. Wash hands and under nails with soap and warm water. Remove rings. If dryness is likely, keep an unscented water-based lubricant nearby. Clean hands prevent micro scratches and reduce infection risk. Lube prevents friction. Step 1. Warm-up and teasing. Arousal for many women is a full-body process, not a switch. Start away from the genitals. Make out. Kiss the neck, collarbones, inner arms. Stroke the lower back, hips, and outer thighs. As you approach the inner thighs, slow down. Over clothing or underwear, press your palm gently over the vulva and hold, then release. Trace the edges of the underwear fabric. The goal is steady, playful pressure waves, on and off, so anticipation rises. Teasing is not filler, it is fuel. It swells blood flow to the clitoris, labia, and vaginal entrance, which amplifies sensation later. Step 2. External touch first, slow and gentle. With underwear still on, outline the outer lips and inner thighs with light strokes. When she says yes to skin, slide a fingertip along the outer lips, then the inner lips. Keep your touch slow and exploratory. Circle around the hooded clitoris rather than directly on the tip at first. Most women find the bare clitoral glands too intense early on. Think feather strokes, then light circles, then slightly firmer ovals. Watch for breath changes, hip movements, and small sounds. Those are your green lights. Step 3. Add rhythm around the clitoris. Every woman's sensitivity is unique, but most prefer rhythmic, consistent patterns over random pokes. Try a gentle around-the-clock circle just outside the clitoral hood. Try vertical strokes from pubic mound downward to the vaginal entrance, then back up. Try side-to-side figure 8s around the hood. Use 2 fingers together for broader contact if she likes more surface area, or a single fingertip for focused pressure if she likes precision. Ask short, specific questions. Softer or firmer? Faster or slower? Higher or lower? Step 4. When to go inside and how. Wetness means arousal, not necessarily readiness for penetration. Check in. Do you want me inside? If yes, add lubricant if needed and start with 1 finger. Never insert dry. Glide slowly into the vaginal entrance and pause just inside so pelvic floor muscles can relax. Use a slow come here motion toward the front wall rather than fast in and out thrusts. Fingers are best at angles and pressure, not speed. Explore gently, a few millimeters up, down, left, and right. If she tenses, withdraw slightly, breathe together, and return to external touch. Step 5. Find the anterior sweet zone. 1 to 2 inches inside on the front, belly side, the tissue often feels a bit spongy or ridged. That anterior zone, sometimes called the G-spot area, becomes more pronounced with arousal. Curl the fingertip toward it in a slow, come here motion. Start with light taps or short strokes, and build pressure only if she asks for it or her body leans into it. Many women prefer a steady, repeatable rhythm more than strength. Keep the other hand free to hold her hip, stroke her lower belly, or continue external clitoral stimulation with the pad of your thumb if she likes blended stimulation. Step 6. Scale thoughtfully, 2 fingers and coordination. If she wants more fullness, partially withdraw, twist slightly, and insert 2 well-lubricated fingers together. Maintain the curl so your fingertips keep contact with the front wall. Combine motions. Inside fingers do a small "come here" or tiny arcs, while your thumb or other hand keeps a consistent pattern around the clitoral hood. Small movements go a long way. The more aroused she is, the less big motion you need. Pressure and consistency become the stars. Step 7. Adjust pressure and speed near climax. As she builds, her cues intensify, hips press, breath quickens, sounds deepen, thighs may tremble. When you find a pace and pressure her body is clearly riding, do not change it. Hold the pattern steady through the finish. If she says "right there," treat it like a lighthouse setting. Stay with it. Many climaxes fade when the stimulation changes at the last second. Step 8. Variations many women enjoy. Hood strokes. 2 fingers forming a V, gently sliding the clitoral hood up and down without exposing the tip. Outer to inner wave. Long stroke from outer thighs to inner thighs to labia, then back out. Resets sensitivity. Pressure hold. Broad, warm palm over the vulva, with a still, gentle press, very calming between peaks. Angle shift. Place a small pillow under her hips to change the angle of the anterior wall for easier fingertip contact. Step 9. Hygiene and comfort notes. Short nails, clean hands, and lube prevent microtears. If you switch from any anal touch back to the vulva or vagina, change the glove or wash thoroughly first. If she feels burning or pain, stop. Add more lube, and return to external touch. Sharp pain is a no. Warmth or stretching is okay only if she says so. Step 10. Talk, then aftercare. Right after a peak, keep your touch steady, but lighten pressure as her body unwinds. Many women enjoy being held, stroked on the ribs or hair, or having their thighs lightly massaged. Offer water. Ask one short question later when she is ready. What did you like most? File the answer. That is the real playbook. A few truths most men never hear. Not every woman climaxes from internal stimulation, and that is normal. Many prefer clitoral-focused touch only, others like a blend. The best way to know is to watch, listen, and ask, and the emotional tone matters. When she feels safe, admired, and unrushed, blood flow and lubrication improve, pelvic floor muscles relax, and pleasure rises. If you found this helpful, subscribe and share this with someone who wants real, respectful guidance. Your hands can be extraordinary instruments when you use them with patience, accuracy, and care. And for men who want to go one step further in supporting performance, there are natural supplements that can help. 2 that I recommend most often are organic watermelon extract, rich in the amino acid citrulline to support nitric oxide and circulation, and an advanced formula that combines icarian, tonkat ali, fenugreek, nettle root, and citrulline to support every aspect of male performance, from erections and stamina to testosterone and prostate health. Links are in the comments and in the video description. Thank you for watching. Take care of yourself. See you in the next one.